Thank you. I think we have a question over here.
Is this working? Yeah. Looking for a comment with respect to environmental considerations, with respect to lifestyle. Obviously, the diet we eat, the exercise we do takes place in the context of our environment, which you alluded to when you were talking about sort of the long-term health of the planet and eating a plant-based diet. Air pollution and other pollutions, I think we need to look at it in this context. Having read studies on pollution and the rates of asthma in kids that exercise in high pollution cities, where unfortunately the actual incidence of asthma, not the severity of it, but the incidence is actually increased in children when they're actually exercising more when they live in a high pollution city. So we have to look at this in the context of the cities we live in, the planning, the built environment that Gary Egger was alluding to that underlies the lifestyle. So I just wanted to see if anyone wanted to make comment on the environment and the effects of this.
Gary's.
Yeah, I think that's important, and I tried to make that obvious when I was talking about the distal factors as influences in chronic disease. But, you know, it's very difficult to get the public interested in this, because when you take the distal factor right back, the main distal factor that's causing most of our problems is having gone past the sweet spot in economic growth, which we probably went past in 1980. And so we're starting to get diminishing returns now. Economic growth means that you have to spend more to consume more to spend more in order for the economy to grow. No politician will talk about the disadvantages of continuing economic growth. Yet Keynes back in 1930 said we may have to grow for 100 years, but after that we can't grow forever. Now I wrote a book, Boyd Swinburne and I wrote a book on this called Planet Obesity, where we talked about economic growth as the main distal factor that had to be looked at. It was the worst seller. I've written 30 books. It was the worst seller I've ever written. And media wasn't interested in it at all. The ABC, a couple of interviews on the ABC, no commercial media at all. Because this is a conflict with modern living, making money or making health. And until we recognise that, we're really bashing our heads up against a brick wall. You can look at other distal factors, you can look at proximal factors, you can change these. But until you look at the really distal factors, and we're going to have to look at it in the near future, because I didn't say this, but you know, the only countries in the world where we've had a decline in population levels of obesity are Cuba, when the Russians left and they went broke, and Nauru, which I've worked up in with WHO, where they ran out of superphosphate and they went broke. And sorry, there's a third society that also has lost weight, and that was Australian Aborigines when Karen O'Dea, the dietitian from Victoria, took them back into the bush and got them on their own native diet. They all lost weight, lost their diabetes and improved their health. But you know, we know that, but nobody wants to talk about it.
I'll append to that. I completely agree with Professor Egger's comments. Two other things about contaminated environments, one regarding trade-offs, the other regarding risk distortion. There's a fascinating book called An Epidemic of Absence. It's all about the origins of autoimmune disease. An Epidemic of Absence. Moises Velasquez Manoff is the author, if you want to know, but An Epidemic of Absence. And really a brilliant job of characterizing changes in hygiene that have eradicated things like intestinal parasites and brought on a tidal wave of autoimmune disease because of dysregulation of our immune system that was designed to fight and cohabitate with those intestinal parasites. So, for example, Sardinia, which used to have malaria as a hyperendemic problem, when they drained the swamps and got rid of the malaria, the Sardinians' immune system gave them the highest rate of multiple sclerosis of any population in the world. There are similar studies related to asthma, changes in hygiene. So there's an issue of trade-offs. Sometimes we wind up with these chronic maladies, partly because of adverse changes in the environment, like pollution, but also partly because of changes in the environment we actually wanted to make that had some unintended consequences. The other key issue is risk distortion. You're absolutely right, and asthma is a very important consideration. On the other hand, the literature is saying that if we didn't smoke, ate well, and were physically active, about 80% of all major chronic disease would go away just with that. It's an invitation to focus on the big picture. And you know, I think people can get hung up on whatever environmental toxin or endocrine disruptor is in the news this week. And I think that makes sense if you are already doing the things that matter most. But if you're smoking, eating hot dogs, and never exercise, and worrying about an endocrine disruptor in the environment, I think you're missing the big picture, right? And I mean, I've had a lot of patients like that over the years.
The gentleman in the grey jacket there.
Thank you for your speeches tonight. It's fantastic, particularly you, David. I've followed your blogs for years. Love your work. Magnificent. A question for all of you, particularly you, Joanna. Why is it that health professionals are reluctant to come down heavily against alcohol? Like, to associate alcohol with obesity and to blow that myth apart, that's not difficult to do. But it's been proven, the British Medical Journal came out recently and said that no safe level of alcohol can be said. That it does get, it's linked to cancer. You made that point yourself. Why don't we come down and say heavily that alcohol should not be drunk? It is a toxin. It is a cytoplasmic toxin. Why is it we have to skirt around the bushes here and say, look, yes, a little bit's okay, when it's not? Like many years ago, and I won't go on for too much longer, many years ago there was a saying, he smokes too much, implying you could smoke a little bit. And now we're saying, oh, he drinks too much, implying you can drink a little bit. Why don't we come down strongly and say alcohol is a cytotoxin, it is carcinogenic, we should not drink at all? Thank you.
Well, I'll clarify first of all, I was certainly not promoting alcohol. I was simply I was being a little bit controversial, but I was trying to emphasize the fact that it's a complicated picture in terms of obesity and overweight. And I made the point about, to me, the problem with alcohol is the health of the liver and the association, as you say, and I made the point about the risk for cancer. So it's about recognizing where that lies within lifestyle medicine and really trying to make sure people have the correct focus if we're talking about overweight, obesity. And for those dietitians in the room, when we're working one-on-one with someone, trying to understand what's going to have the biggest impact on their overall health, because we can't change everything about it. The guidelines around alcohol are strong here in Australia. People are generally not following them. We have a huge problem with overconsumption of alcohol, but I disagree that health professionals don't come down strongly on it. We do have a strong government policy, and I think the recommendations about the 2 drinks a day, which is what our recommendation here is in Australia, were based on the original research in heart disease suggesting that small amounts of regular alcohol, drinking the sort of Mediterranean diet kind of way, was beneficial for heart disease. Now, although there have been some papers questioning that more of late, and particularly with the associations with cancer, I know some people are arguing we should be stronger on that. But coming back to David's point about bigger picture when we're looking at the overall health of Australia, I still firmly believe that our focus has to be on what are the key factors about diet, because I think that is what's killing more Australians, other than when you look at pockets of very big drinkers. But I hear what you're saying.
Hey, there you go. There you go. All right, we'll work either way. I want to return a little bit to the economic argument, which is what I was thinking, but you already brought it up, so that's good. But just quickly, just adding a comment in there, the seasonal eating, fermenting fruits were only available at a certain period of time, and we've got the Maryland tree with the elephants, and they only do it once a year. I mean, it's just 7 days a week. It's just 24 hours a day pressure. But the economic argument, the discussion again, this pressure of economy over everything, and just using the basic example of climate change issue, where we've got 98% of the scientists screaming at it's really biting on our heels, yet the argument is still strong because there are huge interests, which just leads to the other sort of question on the tail of that. How come it's beneficial on some sort of economic, socio-economic, cultural level for us to have this 80% additional heart disease?
Well, there are enormous forces that profit from the status quo. It's not necessarily that anybody thought, hey, if we give lots of people heart disease they don't need, it'll be terrific. I think you could argue that to some extent we blundered into some of what's going on, right? I mean, throughout most of human history, our ingenuity was focused on overcoming the problems. I think you addressed this very well. We were fixing what was broken. It was hard to have enough food. We got better and better at producing enough food until we had too much. It was hard to avoid physical activity. We got better and better at replacing it with labor-saving technology until we weren't using our muscles enough, right? So we're victims of our own success, and I think one of the great challenges of the adaptability of human resourcefulness and ingenuity is can we in fact overcome the challenges of our excessive success? I think that's going to be the next chapter in human health. We either will or we won't.
Could I add to that? I think I want to make it clear that what I said, I'm not saying that economic growth has not been tremendously beneficial for humankind. But like any economist knows that you reach a point of diminishing returns where the extra dollars you add into the investment, you get less back from it. We reached that in terms of obesity and human health in 1980 in Australia. You can pretty much pinpoint it to the month. And so the economy and human life and everything is dynamic. It's not static. This is what the public often thinks. Everything is static, it stays the same, stays exactly the same. And the faster we move, the more dynamic it becomes. So we have to be ahead of the curve rather than behind the curve or even with the curve as we are now.
But there are big winners now. And in fact, you could argue that perpetual confusion about diet is a big win for the publishing industry. It's a big win for the media. I used to work for Good Morning America in the United States. They wanted me to talk about a different diet every week. If we all just knew what healthy eating is, all those stories would go away. It's a big win for big food because they can keep developing new varieties of junk food and convincing us that that's what we should be eating this week. Currently, gluten-free junk, right? Help yourselves. It's a big win for Big Pharma, which is using its products to treat the diseases we never needed to get in the first place. And, it's hard not to imagine, the CEO of Big Food and the CEO of Big Pharma in a smoky boardroom shaking hands where they say, hey, let's put fast food restaurants in the lobby of the hospital, the coronary care unit on the second floor, everybody wins, right? And, again, we blundered into some of this, but some of it seems downright nefarious. So there are winners, and the problem at any given time in history is the people winning with the status quo are the ones making money with the status quo, so they're the ones with the money now fighting change. But that's been true with tobacco, and it's been true with climate. It's been true of everything important in, basically the fulfillment of a better human destiny. We must overcome them.
I think we've got time for one more question at the back.
Touched on this in the last question, but one of the things that's not really mentioned about all of these blue zones is that they also have something else in common, and that's an incredibly low population density for an incredibly fertile area to live in. Now, if you eliminated all of the economical pressures for processed foods, you'd still have the problem of getting the calories to the highly popular dense areas. I'm just wondering where you think we need to go to be able to address that as a technical issue rather than as an economic one.
So two comments. First, the mention of population density, it's a nice place to end because we should acknowledge that one of the biggest drivers of all the things that threaten the future is that there are more than 8 billion Homo sapiens on the planet, and the number keeps rising, and it's enough of us, frankly, right? We've gone forth, we've multiplied, we're done, we need to stabilize now, and whether that's economic, whether we shrink or we stabilize, but enough, and so population density is a huge issue. To my knowledge, and I would defer to Dan Buettner on the topic any day, but to my knowledge, there are a couple of the blue zones that actually have high population density. So the Loma Linda, California, is a very densely populated area. The Seventh-day Adventists are right in the middle of it, so that they're a little island of sort of culture-driven behavior, but right in the middle of mainstream America. So I don't think that's the answer there. I think you're quite right about Ikaria, Greece in particular, and Sardinia, and probably Costa Rica. I think it's less the case in Okinawa. Japan's pretty densely populated as well. So again, I think the blue zones are a story of homogeneity in terms of a basic theme, but also marked heterogeneity in terms of the details of how it all plays out. And I think there's real beauty in that because it says there are different ways to get there from here. It can work in a densely populated area like Loma Linda, which has access to everything going on in mainstream American culture, but where their culture is a buttress against that. Or it can work if you are herding your goats in Ikaria, Greece, but you don't have to do it that way.
I think coming back to an earlier point, the economic drivers, if they were better aligned with the betterment of health, then that of itself would be a massive change. So you take agriculture. Agriculture has responded fantastically well for the challenge to feed the growing population. Our agricultural scientists have done everything they've been asked to do. Even public health messages, the population responds. You see a decline in saturated fat intake in the early 1980s when that was seen as a public health message. Vegetable oil intake went up to countermount that perfectly.
We didn't quite get it right, but we tried.
But so the population is responsive. Agriculture is able to do the job we need. And really what we need to ask is the commercial gain from any given activity at least alignable with the betterment of human health? If it's not, we shouldn't be doing it. That's a really simple diagnostic. If it could be better aligned, let's do that. Let's work together, because it's through that better alignment that everybody will do well, both commercially and in public health. So,
Thank you, Stephen. The clock's telling us we've run out of time. So,
And you don't want to mess with her.
No, I don't want to mess with her. So thank you very much for joining us tonight. Thanks to all our speakers. Hope you've enjoyed the talk tonight.